a upper implant bridge for you, and we are now about a year out from when we did that for you. You've now had a chance to be able to use it and enjoy it, and I'm curious to know how it has affected your life on a regular daily basis.
I feel better. I feel more confident. I can go to bed and not worry about taking a denture out. So I just feel normal. I feel like it's a part of me.
Yeah,
The in which it is.
yeah.
So brush like I would normally. I that they're my own teeth. I eat. Don't have to worry about eating certain type of foods. Have to take care of them like they're my own teeth, so I don't get the buildup of
Foods.
foods and plaque. So I go to the dentist like I would normally with a checkup and a cleaning, and try to make sure that I don't, like keep my gum healthy by doing the flossing and the water pick.
So also tell me about how it's helped you just in how you've presented to other people and your level of confidence, where you might have been before to kind of how you are now. I see you smiling off of that right off the bat.
Well, it's almost like my own little secret because people, you get the compliments and you got great teeth. Oh, your teeth are beautiful, or, like, what's and I sort of laugh.
Yeah.
And if my daughter's with me, she will laugh.
You guys get
And
to
I
look at each other and kind of wink, wink.
Yeah, it's like, and then they're like, my daughter said to me and says, "Well, she was a hygienist, and she's like, you got beautiful teeth." And I said, "Yeah, I paid for them."
Would you think, you mentioned to me before about how you should have maybe done this before.
I would have done this before. I would have done this earlier. Like I'm grateful that I have it now. But if I had have done it earlier, the confidence and how I feel about myself now would have been good. I think that the short, you can get a short end of the stick when you're not given an opportunity or told what the possibilities could be for you. And it shouldn't be a money matter because everything, it depends on what a person values.
Yeah, yeah.
It would have been an investment for me. It would have turned out great for me to continuously have this smile. I've been working in cosmetics for years, and I've been coming to a dentist for years. So out of all those times that I was at dentist's office, I was told like, well, maybe you should just take them out. In other words, I feel that a few of the dentists that I have gone to looked into my pocketbook and decided that I wouldn't afford it, can't afford it, or whatever. They didn't give me the opportunity to say, I can do this.
Right.
Or I want to do this. Or I want to have a beautiful smile. I want to eat without having to worry about taking out dentures or anything. And I think I was slighted on that. That's it.
Yeah.
And I'm grateful that I did come to you.
Well, thank you.
And I'm grateful for my daughter, which is a hygienist. And she said, well, had you thought about doing this? Like you may have to take out all your teeth, or, like you have to get implants and everything. And by coming to you and you explaining this to me, that the possibility could be there and think about it. And you work with me and been patient, and you let me know that it takes procedures that you go through, and that way my financial situation would have been spread out. I wouldn't have had to pay all of this amount at one time.
Right. There's more than one way to be able to get there and to be able to get the same goal.
Right.
Thank you.